I'm Dr. Neel Prakash.
Hi, I'm Dr. Amy Prakash. Neil and I met in medical school. We got married after medical school, so in 2002, and we have three beautiful daughters.
So I remember our first OB ultrasound. Of course, ultrasound, it's in my wheelhouse. I'm a radiologist. I'm a musculoskeletal radiologist, so don't read a ton of pelvic ultrasounds, but I was interested to see, the baby and see what we saw. And besides seeing the baby, which is extremely exciting, I noticed there was a little fibroid. A couple years later, Amy was pregnant with our second daughter, Sonia. And so now we're in 2009. And so when we went for our ultrasound then, I was curious, one of these fibroids changed a bit, and it got smaller.
In 2015, with my third pregnancy, I started having hip pain. I thought maybe it was just related to the pregnancy and,
He's a musculoskeletal radiologist. I said, okay, this is something I can help with, So we talked about it. I had an idea, maybe she's dealing with something like a labral tear. Maybe it's something as simple as some tendinopathy. So we thought it was a good idea to get an MRI. And so we went ahead and did that. It was stone cold negative. I mean, she had a perfect hip, nothing wrong with it. So yeah, we didn't know what to do with this hip pain. And we kind of, she dealt with it.
Well, it wasn't until 2021 when I started having, just some problems with, you know, heavy bleeding, unfortunately. And that was what triggered the whole workup. And we found out that my fibroid that was smaller in the past had, since I wasn't subsequently pregnant again, had grown much larger in size.
Amy had an ultrasound and it came back and said there's a 6 centimeter mass in her uterus.
Yeah,
And
it's a little frightening.
we were shocked.
Well, fortunately, my gynecologist at the time, her husband's actually a radiologist as well. And so, she kind of went through the different options and she told me, you can have you could have surgery, hysterectomy. Given my age, we wouldn't do a fibroidectomy, but she said, otherwise, there's this procedure, a uterine artery embolization. It's a interventional radiology procedure. And to be quite honest, I wasn't very familiar with it. So obviously, as soon as I finished the visit, I got, out and called Neil, and it was great because he obviously was familiar with it. And as excellent as his partners are, I literally was on a phone call with one of his partners, I think within the half an hour to discuss it. So.
The uterine artery embolization procedure, we typically use a right common femoral artery approach. It can be done radially as well. We typically always go right common femoral artery. And it's just a traditional angiogram with a 5 French sheath, flush catheter. I like to look for ovarian feeders at the level of the renal arteries prior to selecting the uterine arteries. And in this case here, we have our angiogram and we do not see any ovarian feeders. And we have faint visualization of the uterine arteries. And then typically what we'll do is we'll get up and over the iliac bifurcation, and then we'll put a reverse curve RUC catheter, which has a large Walden loop. And we'll use that catheter to select the contralateral left uterine artery. And once we're in the origin, we will slide a microcatheter into the uterine artery past the vaginocervical branches and do a confirmation angiogram, which you can see here. And in this imaging, you can see the uterus is enhancing and we see minimal, if any, filling of the fibroid from the left side. And then once we have the catheter in a good position, we will go ahead and perform the embolization using 500 to 700 micron embosphere particles until we get near stasis within the artery. So then after we complete the left side and we remove the microcatheter, we use the RUC reverse curve catheter to gain access into the right internal iliac artery. And in Amy's case, she actually had a kind of an acute angle for the uterine. You can see where the uterine artery is coming off here, that it's making a 180-degree turn at its origin, which made things a little bit more difficult, but the catheter is able to get into the origin, and then the microcatheter, we simply put that down to the distal main left uterine artery. And you can see here that the fibroid hyperenhances, and you can see the majority of the fibroid is filling from the right-sided injection. And this side typically would take more particles since there's more vascular flow going to the fibroid. And in a same thing that we typically put particles in until we get near stasis within the artery, and then we're done with the procedure. So after the procedure, Amy had a fairly typical recovery, and her findings on our 3-month follow-up were actually one of the more profound follow-ups that we've had. You can see here again on the pre-imaging, the patient's large intramural fibroid, on the T2 imaging and the post-contrasted imaging. And on our 3-month follow-up, you can see there was near complete resolution of the fibroid with almost no residual remaining. And what was also very interesting was that her uterus went from a posterior orientation to a more normal anterior orientation after the fibroid completely involuted and likely passed. I would say for us, it's an extremely satisfying procedure just because the results are so good and the vast majority of patients have a significant improvement in their quality of life. And their symptoms that they've been dealing with for many years are finally resolved. And it's pretty incredible that, that a relatively non-invasive outpatient procedure, can give the patient such a positive impact.
I was back to work within, I don't even know, like less than a week. So obviously much less than having surgery, which would have been 6 weeks at the very least probably. And no hip pain. My hip pain went away.
That was the biggest shock, right?
Yes.
There. All my radiology skills, and I never knew that could potentially give you this referred pain, and it hasn't come back, and that was it. Never thought I'd have to look for a fibroid as a cause of hip pain.
From a medical standpoint, but also from a personal, like being the patient standpoint, pretty significant change in my quality of life. The changes were profound. I just think it's an amazing procedure.